Hi, I'm Elizabeth Johnson, co-president of the Manhasset Chamber of Commerce, bringing you the latest updates during this pandemic. Now, as we enter the second week of May, a glimmer of hope rises with the numbers relating to the COVID-19 pandemic continuing to decline. Good news! Town of North Hempstead parks will reopen for passive use starting Monday, May 11th. The championship golf course at Harbor Links will also be reopening on a limited basis on May 11th as well. Everyone is still being advised that they must follow precautionary measures to ensure the safety of both residents and employees. Supervisor Judy Bosworth joined with other town supervisors across Long Island last week to form a Nassau-Suffolk Joint Summer Operations Task Force. The group's collaboration on when to strategically reopen recreational facilities is designed to prevent potential surge in crowding at any particular town or location due to a lack of coordination. For the latest town updates, visit www.northampsteadnewyork.gov/coronavirus. Fitness. When you stay in place, it's important to make sure you move about to keep yourself healthy. I had the opportunity to speak with a local fitness expert, Dr. Dagon Kwan of Kwan's Wellness and Karate, on how his business is faring during this pandemic. He has put together a program which allows his clientele to work on skills on a daily basis. Dr. Kwan, thank you so much for being my guest today. I really appreciate it. How has your business been impacted by this pandemic?
Hello, how are you, Elizabeth? This is Dagan. I'm an owner and instructor here at Quan's. This pandemic was hit very hard in our school as well as many local small operations. We have about 300 members actively training before March, and currently most of are training online, and we lost about a good 40% of our membership are on hold. And there are many families that are still supporting our school, but we are improvising and learning and trying to be creative as much as I can until we could reopen our school.
So one of the things that I marveled at about your school, you've always been a forward thinker and thinking outside of the box. One of the first things that you had done and have been doing for a long time is videoing the class, or at least the participation of the various levels in your classes. And when the stay-at-home announcement came in, you didn't have to change too much because you were already in that video mode. So can you explain to the viewership what you do for your classes?
The first, we didn't want to change reality versus the digital class. So what I mean by it was we teach a lot of children, and I believe that children needs to maintain that structured life and have some order in their daily routine. So we actually kept our schedule very similar to their daily activity. So Monday through Saturday, we kept most of class, similar days, a similar time. And we kept the structure of class very similar to in-class versus online class. And one thing that we do really well in our school was give a positive feedback and very objective feedback. So there's a 3 instructor log into digital class all simultaneously. One hosts the class and teaches the class. 2 other instructor look at the student and give the feedback as objectively as possible. And we record that class and we post it on private video to our own private page. So students that missed the class, they could go back and watch that class again. And also, So that's been very lucky, and we've been very fortunate. one of our staff is he worked at a programming company before, so he was very good at helping us to transition this before. So.
That's fantastic. And going forward, okay, one of the, I understand that we will be rolled out back into business in stages. But one of the things that is really, I think, on the forefront is, exercise and, gyms. And how would you roll out, actually having classes? I mean, you have a huge space, but the social distancing and the face coverings are definitely something that would be important to understand.
Okay, we're doing a few stages. First, we sent out an email this month and last month about survey. So we are looking at we used to have unlimited classes. They could come any days, as many times as they wanted. But now we're restricting that into the register. They have their permanent days, and they could make up their days in other days. So we measure the space, and we calculate the number of students that we could put into the class. So we used to fit about 35 to 40 students. We are downsizing to about 20 or less per class. And they
Okay.
have their assigned date and days they could come into. And we used to have a class back to back, but there is transitioning that we worry. So we are putting a little time between the classes. So we're doing a lot of modification, and we order about 200 masks so far. So we're gonna try to deliver or have the student come and pick up their mask and practice at home at least 1 week, putting a mask and doing jumping jack and burpees, so they don't have a habit of touching their face. So
Right.
it will be very interesting to see all the students covered up, maintaining a distance and wearing a mask and practicing cleaning in and out, like cleaning their hands before they enter the school. And immediately
Right.
after they finish their class, they clean their hands, leave. Those are simple things that we want to make sure that all the students follow and have a habit of. So we trying to build a stronger habit. So when they go back to school system, and I want them all to use this opportunity to prevent maybe we could prevent a lot more flu upcoming year.
Yeah, definitely. Well, I know that you've always used Purell and had it available entering and exiting the dojo. Would you say that your class schedule will change and increase or decrease?
Since the New York State schools officially closed for 2019-2020 school year, they'll do all classes online. So we will have a meeting this week to try to accommodate our students. So we probably will have a morning classes and afternoon classes until the summer. So I guess our answer is more classes, but that depends on the survey. We keep our communication channel open, text, email, and a phone call and a Facebook. So it depends on what parents need. We try to achieve, but usually during the summer, Manhasset community and Great Neck and Port, they usually go away. So we usually have very small classes during the summer.
Right.
People are not traveling as much as they have done before. That will open up more classes. And this is a part that I don't think none of us have answer to. So we are constantly engaging our parents by email and a text to find out the more information. Every week is every week we are trying to solve a little bit of problem.
Mm-hmm. Yes, it's quite a challenging environment, especially for a business that has been in place since 1984. You've always been there for the Manhasset and the Peninsula communities that come to you. I know people come in from far and wide because of the reputation that you've established, and now more than ever, because I just am amazed at how you set this whole thing up. I mean, I see every day that you send out an email, the communication lines are open, and I can only wish you the best for the future.
Thank you very much. By the way, we had a student join from Viera, Florida. We had a student join from North Carolina. We had a student join from New York City. It's not a lot, but if you change perspective, I think there's always opportunity. And we try to think this time as, get stronger, overcome it. And whatever we preach to our student, we try to practice our end as well. It's very tough, but at the end of the day, we get to spend some time with the family, stay home, and make the most out of it, and try to work together while we can.
Okay, so I would ask then, if someone wanted to join Kwan's, what do they do?
They could simply text us 516-627-1122, or they could just email us and call us, any means of communication. We are open to all.
Okay, that's great. Well, thank you so much for taking time out of your busy day.
Okay, thank you so much for inviting us and sharing our experience. Hope everybody stays healthy, and hope we get to see each other soon.
Project Independence. The town of North Hempstead's Aging in Place initiative will be offering a slate of at-home exercise classes for seniors, in keeping with recommendations to stay at home whenever possible. The exercise classes will now be remotely recorded and offered to residents free of charge. The Project Independence exercise classes will be on Channel 18 or 63 on Optimum and Channel 46 on FiOS. Offerings include fitness, Zumba, and yoga classes. New programs will air on Mondays at 10 a.m. and 1 p.m., with many of the classes happening at the same time as they would in person. For a complete schedule, visit mynorthhempsteadtv.com. How to help the hungry. Nassau County legislatures have linked up with Long Island Care's Harry Chapin Food Bank to host a virtual food drive for those who have been negatively impacted by the pandemic. The virtual food drive is a great way to donate without leaving your home. Simply visit the link www.yougivegoods.com/Nassau County Legislators and click Shop Now. Long Island Cares will receive the donated food and they will provide the food to those in need. Medical treatment. Many medical practices are only dealing with emergency calls and essential services in compliance with the government guidelines for social distancing. Offices are scheduling in-person visits for urgent needs only. I had the opportunity to speak with Dr. Matthew Ackert of Northwell's Vascular Center to tell me how his office handles patients on an outpatient basis.
Good evening, Dr. Ackert, and thank you for joining me on From the Source.
Good evening, Elizabeth. Good to be here.
So, Dr. Ackert, I know that you do a lot of outpatient services through Northwell. Can you tell me what your typical procedure is that you do on an outpatient basis?
Yes, I work in the endovascular program for Northwell, which mostly concerns itself with dialysis patients who have fistulas, and I'll explain that in a moment, and need help to make them bigger, to declot them, to help the flow better, and other vascular procedures such as Mediport insertions for chemotherapy, varicose vein ligations, but our primary mission is to take care of the dialysis patients.
Can you explain what a fistula is?
It's basically a connection in the arm, typically between a vein and an artery. When patients need dialysis, they need a large blood vessel for the needles to go into. And by joining up two vessels in the arm, it creates a much larger vessel that's more easily accessed for dialysis. It is an operative procedure, and it takes a while for the vessel to get bigger. And one of the things that we do at our endovascular center is we help mature the vessels to get them bigger, and then we take care of them later on if they get smaller.
So, in light of COVID-19, can you tell me what has changed in the way that you do business?
Well, we have a slightly less volume because we're not doing any elective cases. The vascular patients that get dialysis, they need dialysis. So if there's something wrong with their fistula, if the dialysis doesn't work well, they need it to get fixed, and they come to us. So it's essential business for these patients, essential work for us. But we're not doing Metaport removals. Say a patient has completed chemotherapy and doesn't need the Metaport anymore, we can wait a month or whenever to remove that. And for those patients with varicose veins, for cosmetic purposes, not for painful varicosities, they will also wait. So we have slightly less volume in our office, but we're still doing quite a business with the dialysis patients because unfortunately they can easily have strictures or clots in their vessels, and they need to get fixed very quickly.
Okay, so tell me, when the patient enters the facility, what is the first thing that happens to them?
Well, they get their temperature taken,
Okay.
often Purell also, and mask and gloves. And we also check their vital signs, including pulse oximetry, because that could be a sign of COVID with a lower oxygen saturation. But the bottom line is we protect them and we protect ourselves. So the main thing is first has always been with the temperature upon arrival. Usually the patients come with their families. Again, masks, gloves are provided if they don't have them. It's essential now. They can't come into the facility without a mask. In fact, in the building, there's a nursing station which will also check for temperatures as patients and anyone comes into the building. But we do check the vital signs upon arrival.
Okay, is there the opportunity for a caregiver to come with them?
Yes, typically the caregiver comes with them, gets them settled in the office, fill out whatever forms need to be filled out. Prior to COVID, the caregiver would come with them into the waiting area prior to going into the operating room, simply to provide extra help with them and just to be with them. But
Right.
because of these issues, now we're asking that the caregivers not stay in the office, and we will call them when the time is ready for pickup.
Oh, I see. Okay. Now, one of
Occasionally, some patients who have special needs will allow the caregiver to stay with those patients if that really makes a difference for them.
do you feel that like your business is totally different now than it was pre-COVID?
It's slightly different. As I said, we're seeing less patients, but we're seeing sicker patients too because of the COVID. We have to be more cautious with the patients. Some patients who have active COVID disease can't come to the office and they will have to go to the hospital. We have patients who have been afraid to come to the outpatient facility for fear of catching COVID. Now, these are patients that don't want to go to the hospital, but by coming to us, in a sense, it's a slightly safer environment. We had one patient a week or two ago who arrived from the dialysis unit because dialysis was not functioning, and his wife was home. She had just recovering from surgery, and she had called him on the phone telling him, "Don't go to the hospital, you'll catch COVID." So our nurse at the vascular center assured her that we're COVID-free, we're very clean, and it's a very minimal chance of catching that at the vascular program. So there's sometimes we're afraid that we may lose patients because of fear of coming out or coming to our facility.
A number of individuals have claimed that they're so afraid of this pandemic that they're afraid to receive any type of medical care. What could you say to allay their fears?
Basically, it's just reassurance. It's to let them know that they will get checked. We check ourselves every day. The cleaning that we do to keep the place sterile is amazing. like anything in life, there's no guarantees, but we do the best that we can to provide a clean, safe environment. And, we ourselves get tested too, and thankfully COVID free. But it's mostly reassurance for the patients that, if you need the work, come to us. We'll take good care of you and we'll get you through safely. And one of the very nice things about where I work in the vascular center, many of the patients are repeat customers. They come back many times because they have to have their fistulas taken care of. And it's a very nice environment for them because you get to know them after a while. For me as an anesthesiologist, it's kind of special that I have continuity of care with these patients. And the x-ray techs are wonderful. We remember things about the patients, about what their favorite music, favorite meals are, and it provides a very nice, relaxing environment for them. So that's a big help for our patients who come back multiple times. It's sometimes a little trickier for the newer patients for the first time they arrive because they don't know what to expect. But in general, patients are very happy when they finish and they leave the facility.
Well, I thank you for explaining that and taking the time out of your very busy day. I know it's late and you probably want to eat dinner. Thanks again.
It's a pleasure. It's a pleasure. Thank you, Elizabeth. Take care, and you be safe too.
When are we going off pause? Governor Cuomo has put together a plan in order to step out of pause. He has regionalized the state. Long Island, which includes Nassau and Suffolk, is considered one region. In order to be released from pause, the following must happen. Hospitalizations. Based on the CDC guidelines, regions must have at least 14 days of decline in total net hospitalizations and deaths on a 3-day rolling average. Nassau County has hit this benchmark. There's been a steady decrease in hospitalizations for the past 21 days. New infections. The region must have fewer than 2 new COVID-19 patients admitted to the hospital per 100,000 residents. In Nassau County, would have to have fewer than 28 new COVID-19 patients admitted to its hospitals. So far, new patient hospitalizations are almost double this figure. Healthcare capacity. Every region must have at least 30% of the total hospital beds and ICU beds available. The hospital ICU beds may not be counted as available unless there is sufficient staffing to cover the beds. Nassau County officials are attempting to determine how much capacity there is in Nassau County hospitals. Personal protection equipment stockpile. There must be at least a 90-day supply of personal protective equipment stockpiled. The county has work to do in meeting this benchmark. Nassau County legislators were told by Police Commissioner Ryder that the county will need 4 or 5 times the amount of warehouse space that currently exists at its emergency management facilities. Diagnostic testing capacity. Each region must have the capacity to conduct 30 diagnostic tests for every 1,000 residents per month. The state is rapidly expanding capacity statewide to help all regions meet this threshold. Nassau County, estimated population of 1.4 million, must have approximately the capacity of 42,000 diagnostic tests per month. Contact tracing capacity. Regions must have a baseline of 30 contact tracers for every 100,000 residents and additional tracers based on the projected number of cases in the region. Nassau County must have approximately 420 contact tracers. Yesterday, the state announced that they will be accepting applications for those interested in becoming a paid contact tracer. For more information and to apply, visit the website coronavirushealth.newyork.gov YouTube.com/get involved, how you can help. Visual delights on YouTube. A virtual tour of Clark Botanic Garden in Albertson has premiered on YouTube. This new virtual programming will highlight the town's community service and parks department. The virtual tour is given by Glenn Ulrich, the educational director of Clark Botanical Gardens. The tour includes a walk down Tulip Avenue and the history of the Clark family and its property. To view the virtual tour, visit Clark Botanical Garden on YouTube. Real estate. Real estate brokers' offices throughout New York State are closed, but buyers are out there and demands for rentals and potential purchases are there as well. I spoke with Annie Holdreth of Daniel Gale Sotheby's International about how their business has changed.
Welcome to From the Source Pandemic Edition. Annie, how has the market changed since COVID-19 has appeared on the scenes?
First of all, Elizabeth, thanks so much for inviting me to be a part of this series. I think the more information we can get out there about how everyone's working is really important. So thanks for inviting me. And how Daniel Gale Sotheby's International Realty pivoted, I guess, when COVID came into play is we went almost 100% virtual, and we luckily had the tech and the resources to allow our agents to work virtual. The work order that came down from Governor Cuomo deemed us as non-essential, but it did say we could work virtually. We can do virtual open houses. We can show homes virtually with seller's permission. We can go in and do a FaceTime call or a Zoom call like we're doing right now.
Right.
And this past weekend, we were pioneers and trailblazers, and the company held over 100 virtual open houses on behalf of their clients this past Sunday on May 3rd. And I'm happy to share that we, in the Manhasset office, we had the most of any of the 27 offices on Long Island, and we have activity as a result of those virtual open houses, which is pretty remarkable.
Wow. So who is looking for houses right now?
Oh, that's a great question. So what we're seeing is, a direct result of the pandemic. We are seeing buyers from Queens and the city who are in smaller places, and it's been in the press, it's been in the Wall Street Journal and New York Times, and people are looking to really escape New York and move out and maybe make that move sooner than they might have. Typically in our market, the trigger can be school. Families that live in the city that have school-age children, when it comes time for schooling in the city, it can be expensive for private schools, and they'll make that move for kindergarten. But we're seeing that buyers are saying, why are we going to wait? If we're going to have a different world and a new normal after this, we want to have a place where we can both work from home, because I think a lot of employers will continue to allow people to work from home. So I'm going to need a home office. We maybe have to continue homeschooling. So city people, and then within our own community or locally here on Long Island, we're seeing people who their current home isn't fitting their needs. So they want to make a change.
Interesting. Yeah, home office, I'm sure, is going to be a hot ticket item.
Home office, home gym, because people are not going to their gyms. Peloton sales are through the roof. You got to have a place for that Peloton. And also, I think mudrooms, because when we enter our homes now, we're making sure we're not wearing shoes in the homes. We may be disrobing in our mudrooms to launder those clothes, depending on the places we've been. So suddenly mudrooms have more importance and a different role to play than even before. So I think there will be changes also in design that come out of this. I've been talking to architect friends, and I know you had TJ on, and I think there will be a change in design and how we live in our homes as a result of this. We're all going to be a lot cleaner.
Definitely a lot cleaner. Tell me, have you closed any deals during this pandemic? And how was it done, if it was?
So we have had properties that went into contract prior to the pandemic that needed to close right as the pandemic was happening and things were being shut down. And the attorney partners and the title companies and the banks and the bank attorneys. We have done what we call parking lot closings. We've done completely virtual closings, and we've done closings where, sorry, that's my Ring doorbell. We've done closings where it's all been done electronically, emailed around, mailed around. So business is still happening. The title companies that have who are also electronic or virtual can still do their functionality and get into access to look at building files virtually. So we've been fortunate to have those properties continue to close, and we're seeing properties being purchased through just virtual showings, which is pretty remarkable too. So there is demand for Manhasset, that's for sure. That has not changed, and we don't have a lot of supply. We don't have enough houses to really suit those buyers that want to make that move. So we need more inventory.
That's great. That's great. So going forward, once we step off of pause, what protections will you have put in place when people actually can physically go to see a house?
So that's an interesting question. We in the office, I'll start with that. We are making changes in our office just to have a safer work environment with physicality, and we have, as a company, put things into place for when we reopen. And I don't think we'll have a wide open in the beginning. I don't think we're going to open the doors and have 100 agents come back to the office, and you may have to come in on an appointment basis. So starting with the office, I think that will become a model too. And we're not so certain homeowners will want us doing public open houses again in the near distant future. We may continue with this virtual model. It's a lot easier on a seller to only have to clean the house once a week, and we go in and show it. There may be demand to keep this model going. But while we are working virtually, even now, we'll continue to follow it. We are masked, we are gloved, we are booted. We are making sure we're asking our homeowners to open all the doors and windows in the house before we come in, like at least an hour before, to create, and change out the air. We are asking anyone that's going to, any of our agents, we have to know they're not sick. They haven't been sick. No one at home's been sick. We're asking our sellers the same thing to protect our agents going in. So I think a lot of that will stay for some amount of time. And we'll have to see how the consumer feels, because we are consumer driven like any other business, on how they want us to work in the future. They may like this model. We have gotten calls from people saying, I'd like to put my house on the market right now because you're only doing it virtually. I don't have to have a parade of people coming through. So people might decide that's a good thing to do.
Great. Well, thank you so much. I know you're busy, especially with all those virtual open houses, and the best of luck to you in the future.
Stay tuned to North Shore Television for the latest information on this pandemic. In the meantime, stay home, wear a mask when out in public, and social distance. Stay safe.